Welcome to my channel. In this lecture, we will discuss the skull mid-sagittal section. This is the playlist of Nutter's anatomy flashcards. The third lecture, that is the skull mid-sagittal section. In this case, the skull is divided into right and left half, and this is the inferior view. You can see. First, we will cover the labels. There are 9 labels. The first label, you can see it shows the yellow section. You can hear what is this? This is the xiphoidal bone. The second label, this is the frontal bone. You can see this is the front side of the skull and this is the back. The front side, we have a frontal bone. The second label is frontal bone. Third, you can see in the gray color, this is the ethmoidal bone. First is the xiphoidal bone, second is the frontal bone, and the third is the ethmoidal bone. The fourth label, you can see just above the teeth, this is the maxilla. As I told you before, the upper teeth are attached to the maxilla. And the fifth label is in the light pink color. This is the vomer bone. This is the vomer. And the sixth is the palatine bone. First label is the xiphoidal, second is the frontal, third is the ethmoidal, fourth we have maxilla, fifth vomer, and the sixth is the palatine bone. I hope so you understand very easy things. And the seventh label, where is it, is the back. So it is the occipital bone. On the back of the skull we have occipital bone. And the eighth, you can see in the pink color, this is the temporal bone. Here it is the temporal bone. Below it we have ears. And the ninth label, this is the parietal bone. It is the above the skull, it is the parietal bone. So I think so, I hope you understand clearly all of this. Fifth, we have a vomer bone. Sixth, we have a palatine bone. Occipital 7. 8, we have a temporal, and 9 is the parietal bone. So next, comments and clinical case we will discuss. Note the interior of the cranium and the nasal septum. There are 8 cranial bones enclosing the brain, including the unpaired frontal, occipital, ethmoidal, and xiphoidal bones. As I told you in the label, you clearly now understand where are its locations. And the paired bones, I told you, temporal bone on the right side and on the left side, and the parietal bone. These two bones are in pair. So total in the cranial skull we have 8 bones, and the 14 we have 14 facial bones, including the paired lacrimal, nasal, palatine, inferior turbinate, maxillary, and zygomatic bones. And the unpaired we have vomer and mandible. Mandible is the lower jaw and it is single bone. The nasal septum is formed by the perpendicular plate of the ethmoidal, vomer, palatine, and the septal cartilage. Nasal septum is made up of these components. The petrous part of the temporal bone, as I told you, it contains the middle and the inner ear cavities and the vestibular system. It's for balance. Next, we have a clinical. A blow or any kind of injury to the skull that result in a fracture can tear the periosteal layer of the dura mater. As I told you in the previous lecture, dura mater, brain skull has a layer of meninges, dura mater, arachnoid, and the pia mater. Dura mater is above, so its fracture chance is increased, which can result in an epidural hematoma or leakage of the cerebrospinal fluid. Next, a slight deviation of nasal septum is common. If there is slight deviation, it's common. However, if the deviation is severe or result in any kind of trauma, it may be corrected surgically so as not to interfere with the breathing. If it's in is severe, it can cause breathing problems. So in this lecture, I will cover the mid-sagittal section in very simple explanation. Very important lecture. I told you all the labels, comments. There are the 8 cranial bones, 14 facial bones, and which bone is paired, unpaired, it's important to remember, and the clinical. These all things are very important, so keep note them. I hope so you like this video. Thank you.